So I'm Mindy Simon. I'm the co-director of the NHS Innovation Accelerator. And we're a program that supports the NHS to address its most pressing needs. We're funded by the Accelerated Access Collaborative, which Roland Sinker just mentioned. And we are here to source and evaluate ready-to-scale innovations. And we assess their evidence and to reassure our stakeholders that these are innovations that are worth using. We do all the legwork to put together a curated pool of ready-to-go innovations so that you don't have to look at this. You'll get dozens of emails every day saying that they are the next best thing. And we make sure that we're here to tell you whether or not they are actually the next best thing. Once we have gone through that really long process of evaluating those innovations, what we do is we support those innovators to create visibility for their innovations, but also to help them to understand how they work better with you and within the system, and also to help the health system work with them. So there are a few of our innovators in the room today, and I'm sure they will grab you at some point to have a quick conversation. And they're here to help us understand what it's like from an innovator's point of view. And I think we'll also benefit from hearing from them, and they'll benefit from hearing from us. If you haven't connected with us, the NIA, previously, then please do grab me or my colleague Ahmed, who's somewhere in this room at the moment, just to have a quick chat. So no obligation quotation from us. So I'm not going to bore you anymore about that. What I think we're here today to do is be a coalition of the willing, which is a phrase I absolutely love. We're here to share, learn, and probably commiserate, given the news last night. We've got some excellent sessions today. So I'm going to get involved with pretty much most of them, which is what won't make them excellent, but I'll try and bring them up. And we'll hear some key leaders and what's happening and what has happened in the system to date, following on from Roland has said to us and kind of set the scene. They won't have all the answers, but they will help us to get us thinking, what would be the answers for future and what we can talk about this afternoon and kind of collaborate on what our practical solutions will be. I think with this shocking news of what's happened last night and all the cuts, I can't think of a better time for everyone to come together to kind of pool our resources and our knowledge. We kind of need to all work together. There's strength in numbers. I think like the IEP, we need to figure out what can be fixed and how we can do that together. So before we move on, can I just do the temperature check? So in Menti, can you put in the code? It should come up on your screen. It's probably really, really small. So 734 76109. That's 734 76109. I feel like I'm reading out bingo. And the question that we'd like to ask you should come up on screen. So with the new government and a 10-year plan that's coming up and a spending review we've been promised and keep waiting for, the NHS will become more innovative in 2025. Can you let us know if you agree with that statement or you don't agree with it? And we'll take a temperature check at the end of this to see if your thinking has changed given the feedback and everything that we've discussed. Oh yeah, I can see where I think it would be going. And you seem to be going in that direction. Great. Now I'm going to bring up our first sort of panelist. So Claire, Nicole, and Tim. Can you join us on stage? Great, thank you so much. So I've got a really great panel here today, and I'm going to let them introduce themselves first of all. And they're going to suggest one thing that their organizations can do to help with the increase of innovation within their own system. So I'm going to start with Nicole. I'm just going to move my way down the line. So Nicole?
Great, thank you very much, Mindy. So I'm Nicole McGlennon, and I'm Managing Director of Health Innovation East Midlands, and we are one of 15 health innovation organisations that make up the Health Innovation Network, which operate across England, and Roland referenced us in his keynote opening. So it's been really difficult to get to this sort of one area, as you can imagine. So I'm just going to give a little bit of background. So we have been in operation, Health Innovation East Midlands, along with colleagues in the network for over 10 years. And during that period, we have built a phenomenal bank of resources, skills and experience and expertise in bringing innovation into the NHS and also into other healthcare settings as well. So during that journey, we're at a point now where we are accelerating what we're doing, and it's very much about supporting systems to find, test and implement research and innovation within systems to make the differences that we're all looking for. So what the key thing is as well is all about sustainability. So, that's what is really important to us within the Health Innovation East Midlands area. What one thing that we have been focusing on for a considerable length of time is actually building and supporting a multidisciplinary environment for the NHS, academia, industry, and other bodies to work collectively together to bring forward innovation at the right time and at the right pace. So for us at the moment within the East Midlands, we're very much harnessing, working with industry and bringing industry into the areas that we've got the greatest need. And if I can just take another moment or two to give you a little bit of background. So more than 5 years ago, actually longer than that, probably about 7 or 8 years ago, Health Innovation East Midlands, which was then the AHSN for the East Midlands, worked with academia. They worked with an industry partner, an innovator, to bring forward a diagnostic test for children and young people within the ADHD area, clinical area. And working with all of our partners, we did indeed test it locally within the East Midlands. We rolled it out and supported the implementation of its testing across broader areas within the East Midlands. And also then we worked with our national network to implement that at national scale. So at the moment, because we do keep a record of the innovations that we have supported and we continue to touch base with to date. So that support and working with industry over the last 5 years has been sustained. So the sustainability is really important to us. But currently it has saved the NHS £40 million worth of efficiency gains, and also really importantly has supported over 80,000 families to date with working collaboratively together with those stakeholders. So our learn and the learnings that we have taken about working in partnership, we are learning by doing, very much what Roland has talked about. And currently, for example, we are working with one of our 5 ICSs who came to us very recently and said, due to the experience you have got with collaborative working and having that broker, the brokerage skills to work with industry, will you support us in reaching out in a very formal way to industry to support them coming to work with us on a particular clinical pathway? And I'm delighted to say that actually we worked with the ABPI, we worked with our NHS locally to put a call out to industry, and that just closed last week. And I'm absolutely thrilled to say from the stage 1 point of view, we have got 5 expressions of interest for industry to want to work on that particular area with one of our systems in the East Midlands. So that for me, Mindy, is the one thing we're focused on. And it's difficult to come down to the one thing because there's so much happening. But for us, and the message to people in this room, both from the NHS and also from innovators, the Health Innovation Network, we are absolutely open for business and wanting to work with you to make a sustainable difference to the care of patients within the East Midlands and beyond.
Great, thank you. Tim?
Tim Jones, Chief Officer, Health Innovation West Midlands, friend and neighbour to Nicole. We work very closely together as part of the 15 health innovation networks across England. I've been with Health Innovation West Midlands for about 18 months. Prior to that, I was an executive of a very large NHS trust, and it's been very interesting for me to be on the other side of the table, looking at why there are problems in how we adopt innovation and looking at it from a different perspective. In terms of what we do, I could say we do the same as Nicole, which we do, but also we act as that bridge between the innovator and the NHS. And we can understand where each organisation is coming from, and they very often come from very different places. And what we can do is to translate it's to advise, and it's to support and accelerate how we get that innovation from the innovator into local adoption, regional adoption, pan-regional adoption, hopefully across the Midlands, and some work that Nicole and I are doing where we're looking at the Midlands leading on some work, as Nicole said, in ADHD, in musculoskeletal work. We can really begin to drive the change that we want to see across the whole of the Midlands. That's our main offer, which is we can bring people together. We are a network. The answer's in our name to a large extent. We can bring the innovator, the NHS, the demand side and the supply side together and ease that process. Because often the languages used are so different that they need a translator. And to a certain extent, if the one thing you take away from us today is that we act as that translator between the two different organisations. So I'll stop there.
Great. And Claire?
Morning, everybody. So my name's Clare Thomason. I'm the Director of Delivery at Midlands and Lancashire CSU. I say Midlands Lancashire CSU, but you may be aware that the 4 CSUs across the country have recently come together under one managing director, and we're operating as a group which effectively has a national footprint now, where we work predominantly with ICBs, providers, NHS England, and we provision a variety of services which I guess come under the umbrella of delivery partner. So anything from kind of transformational services, back office, clinical, digital, at-scale services, and we have a number of innovation offers that we provision as well. And a lot of our work really centres around taking some of that innovation and the work that we do and really working in partnership with our partners to support them to implement that. So very much about making sure that that innovation is real. We have a number of ex-clinicians, ex-NHS managers who work with us who can do that, almost that brokerage and that problem solving, having worked in that landscape. So it really helps that kind of transition and that uptake of innovation.
Great, thanks very much. So I just want to go across to Nicole first. You mentioned quite a lot about sustainability and making sure those innovations stay embedded. What are the barriers you think, kind of biggest barriers you've faced in making sure that they are sustainable?
I'm not sure we've got enough time, Mindy, have we? But yeah, look, I think that's the question that we're asked quite a bit. And certainly Roland did mention that. And what I think, I'm just going to mention one barrier because I would like to flip it to maybe a little bit more of a solutions rather than, because I think we're in a world where we're just facing challenges all the time and it can clutter our brains a little bit. I think the culture is really important. And I think over the period that we have been in operation, and I'm sure Tim and Claire will probably agree that, it's having the right culture within the NHS to want to bring in support and nurture innovation. And within the network, we will support systems to do that, but we'll also say to them, be prepared to fail quickly. If we're going, we need to get this right and be prepared to fail. And that in itself is also a big, big challenge. But a lot of the research that we've done as a network around barriers, we have really tried to bring solutions forward. So just forgive me for sort of looking down here, but I won't talk about them in any great detail. But trying to overcome barriers is really, I think, everybody's responsibility. It's not just the Health Innovation Network or senior leaders within the environments that we're working. It's everyone's responsibility. But the network has put together what we call the 7 habits to accelerate the adoption of innovation and to counteract barriers. And I will just name them without going into any sort of detail. And it won't be, this isn't rocket science, but it is about thinking about pathways first. It's not just about the innovation and, the fact that actually we think it can make a difference. It's where does it fit in the pathway? And what do we need to get right for that whole patient and clinician journey? And then we talk around making sure we have got an informed plan, a true game plan that involves all stakeholders, that I mentioned earlier on, with a clear vision and clear purpose behind it. And there are a number of other key pillars that, Tim mentioned as well, about stimulating demand and not just supply, making sure that we've got the right demand signals coming to bring forward those solutions and challenge those particular barriers. And also be very clear that actually what we're trying to do is also challenge policy. And we very much support in the Health Innovation Network that to make changes sustainable and to get them embedded, you've got to also look at the policies you have in place at both local and regional and national level as well. So, and then the last point, Mindy, I think is very much, what Roland was, I guess, being very clear about. I mean, we did recognise from how he was saying, his keynote speech, that it was quite a challenge for them to drive through some of these suggestions in the IEP. But the key thing is, and this is where he is as well, is let's stay with it. So that is the number 7 habit we would recommend within the network, is stay with your plan and make sure it's sustained and embedded.
Excellent, great. I like that about stay with your plan, because I think everything changes quite often, as you will see. Every day we look at the news and something new has come up and it surprises us. So I think it's difficult, but I think if you keep focused, you're absolutely right.
Yeah.
So Tim, you said you're the bridge between the NHS and innovators, which is excellent. They need a good bridge. How do you demand signal so that innovators know what the NHS want and really let the NHS know what's out there?
Yeah, it's a difficult area which we would have thought would be quite easy to do, demand signalling, in terms of the NHS being clear as to where are the areas that we need to resolve issues. The NHS is very good at explaining the challenges and the problems, not so good at having very clear definitions of what the solutions need to be. And part of our work is to then challenge the NHS to say, well, what is it, the problem that you're trying to solve, not the challenge that you're trying to get over? And then how do we turn that challenge into a solution set so that industry innovators can very clearly see where they sit within those challenges? And that, to me, is the key to the way that we undertake demand signalling. The other part that we have to do is to make sure that the innovators listen to the demand signalling that we're giving out, because innovators come up with innovations which are great, but they may not sit in the pathway, as Nicole mentioned. And if there's any message that goes out from today, it's all about the pathway. It's not the product, it's the pathway. Where does it sit in that wider pathway? Where do you get the whole system end-to-end benefit? And in terms of demand signalling, we need to make clearer in what it is we're asking for and where it sits in that pathway from one end to the other. Be clear about the value that we see within that pathway. And we don't tend to do that early enough in terms of the way that we develop our innovations. And then make it very clear to the innovator where they sit in that pathway and what is it that they're actually undertaking. Because a lot of the innovations we see will resolve one step in the pathway, but actually what they do is they shift a lot of activity then in further down the pathway and actually devalues the impact that innovation can have. So pathway is very important to us. Clarity is very important to us. Defining what we're trying to do, very important to us.
Excellent, great. And Claire, I imagine that once they have defined that pathway and they brought that innovation in, it now comes up to you and the CSU to try and help implement that. Do you want to kind of talk us through any kind of barriers you face, or let's follow on from Nicole and be a little bit more positive, what these solutions could be to making sure they're implemented in a sustained way?
It's always challenging, isn't it, trying to get adoption of new things. You know, you've got all of that combination of factors of trying to understand what that innovation is, the kind of, disrupting the status quo and how things are currently delivered is a really emotional journey, I think, for, clinicians and providers that are delivering services. I think some of the things that the CSU do to kind of support some of that is I think it helps having that kind of understanding of healthcare services, having that clinical background and that clinical community that can come in. And I think also just having those kind of transformation, change management, improvement skills around that can help to really kind of understand and broker some of the challenges that people delivering care experience every day. And it's that listening to that and looking at how can we problem solve this, how can we solution it so that it is sustainable. And, I think some of the things that we see when we bring some of that into our pathway and service redesign are very much as Tim's described. You put one innovation here, but actually it shifts something somewhere else. And there's not always the time, effort, money, etc. to kind of look at that in that way. And that's why things sometimes fall down and aren't adopted consistently.
Great. I know we're kind of running out of time, but I kind of want to wind up and just say, from what I've heard from everybody in this, it's about the culture and it's about the people. So it's the people who create those innovations, it's the people who get those innovations taken in, and then the people who actually help deliver it. And that's the kind of things we need to support, not just the actual innovations itself. Yeah, great. So we're going to hand over now. I think it's Andrew next. Great. So do we have any questions within the audience? I can't see. Oh, I can see a hand coming up way back. Please, if you could just tell us who you are and then ask your question.
Hello there. Mark Ratnaraja, paediatrician and managing director at C2AI. We provide AI analytics services to the NHS and ICBs. Thank you very much to the panel for your insights. A comment and then a question. Often there's a lot of investment in innovation, but very little in change management and providing resources in order to deliver that. Do you think there's a responsibility for the NHS to look at innovation from the perspective of what works and then be behooved to adopt it and provide the resources in order to enable that? Because benign neglect is the biggest enemy for innovation.
Pick that up firstly and then offer it out to the panel. Yeah. Change adoption, change management in the NHS is something that we need to look at. And one of the areas as a HIN we will look at is the resilience and sustainability of that innovation. And one of the things that we do talk to our innovators about is the true cost of the innovation and the true value. And for obvious reasons, sometimes the true cost is underestimated and the true value overestimated. And it's much better if we have those discussions right at the beginning as to how much the cost will be. I think I heard that you're in AI, working out the true cost of AI, the 5-year model that sits behind AI, what some people see as hidden costs, the constant monitoring of AI, which always seems to come as a surprise to people who are adopting it, are those areas that we need to have a far more mature discussion about. And one of the things that we are pushing within the HINs is to get more of that digital maturity into systems so people can work out what the real cost and benefit is rather than what is immediately in front of you. It needs that longer term approach, that 3-5 year approach behind what we're doing. Unfortunately, the way the NHS runs, that's not always possible, but to have those discussions right up front eases that longer term change management process. I don't know, Nicole.
I'd absolutely agree. I think it's really underestimated the effort and resource that's required to implement change management, and that's often overlooked. It's kind of, we've seen something, we need to adopt it. Let's just get on without winning the hearts and minds and doing the groundwork that's required to enable that to be sustainable. I think one of the things that one of our kind of specialist units delivers is the School for Change Agents, which puts that emphasis on embedding those change management skills fundamentally across the NHS in clinicians and providers across all areas to try and stimulate and give that capacity and capability to that change management element, which hopefully would help to support adoption, really.
Can I just ask, I know we're thinking about things in the long term, but with the government's new shift towards the failing fast, how do we think that's going to influence that kind of long-term thinking?
Well, I'll give you the view that we have at the moment, Mindy. So we recognise the 3 shifts that have come out from the Secretary of State. which are really high profile. And actually within a health innovation network, we are very much focused on delivering those three shifts. But I think the key thing is also is this transformation piece. And there is, I think, a drive, and Roland talked about it in the IEP programme as well, looking at this in more variation as well, and how we can spread innovation further and faster and at greater scale. And that is also part of the recommendations that have been put forward to government, both in this particular plan that Roland's been leading, but also in the 10-year plan and the life sciences plan as well. So, we don't have a crystal ball either, like anyone else in this room, but I think these are areas that have been put forward for longer funding periods, as Tim was suggesting, but also recognition that actually, if we have great innovation working in one part of the country, why is it not working in another? And I think we're certainly hearing the messages coming from government that they want to see more of that adoption and spread and scale at an accelerated pace.
And again, 2 minutes. Do we have time for one more question in that case?
That's a big
Great,
sign.
I can see someone in the front here.
Adam Townsend, View at Data Labs. It's the question is around the three fundamental shifts, and how do the health innovation networks see themselves shifting into the prevention space, not secondary prevention, not admission avoidance, but true improved well-being and impacting wider determinants, so that actually that true prevention agenda and that the innovations in that space around joint working across health and local authority, for example, or schools, how are you going to move into those spaces and shape your organisation to facilitate innovation there, which is somewhere typically you might not have been, but ultimately is perhaps where the game needs to be played going forward?
Well, I'd just kick off with that. And I think, Andy, that's a great question, because we all recognise that there's a huge amount of work that we could be involved in across public sector, schools, etc. I guess if I'll just talk from my own East Midlands perspective, we do quite a lot of work with public health, with some of the programmes and innovations that we have got, and we can only see that increasing. I think beyond that would be a significant challenge for us. We are a limited network with very clear remit on certain areas of work, but certainly most of our health innovation organisations will work with as many providers, suppliers as we possibly can. It's not maybe a focus for us to go into certain areas, but certainly public health is an area that we're increasingly working with, and we do see them coming to us with regards to the preventative agenda. And we have got a number of innovations within that space, but also what we will do within the network is, if we haven't got them or we're not aware of them, what we will do is put calls out to industry to bring them forward. And that's an area that we all actually work within the network through our Innovation Exchange programme. So I think we very much willing to open up those avenues. And what we are seeing is public health particularly coming to us a lot more than they have done previously.
Okay. Thank you so much, Nicole, for that really detailed answer. I think our 2 minutes is up right now. So it was just left me to thank you all very much for your input. It's been great hearing from you. Great.